Hello friends, in continuation with the previous video, welcome to the second part of the numerical questions asked in the NEET PG and AIMS PG entrance exams. So without any delay, here comes the first question. A new drug X is given to a healthy volunteer in a dose of 100 mg. Plasma concentration of the drug is measured at hourly intervals and a graph is plotted between plasma concentration and time as shown in this figure. Which of the following statements about the drug X is true? Option A. Its Cmax is 20 microgram per dl. Cmax is the maximum concentration attained, and here we can see that it is 27 microgram per dl. And now option B, AUC, that is area under curve, from the above graph reflects the rate of absorption. Well, AUC, that is area under curve, reflects the extent or amount of absorption and not the rate of absorption. Option C, Tmax is 7 hours. In this graph, we can very clearly see that the Tmax is 4 hours and not the 7 hours. Option D, instead of 100 mg, drug X should be given in divided doses. In this graph, we can see that when this drug is given in a dose of 100 mg, it produces a Cmax, that is 27 microgram per dl, which is more than the minimum toxic concentration of this drug, that is 20 microgram per dl. Thus, to avoid the toxic effects, Cmax should be lower, and to produce a lower Cmax, the initial dose of the drug needs to be reduced, or the drug may be given in multiple smaller doses. So this option is correct. So now here comes the next, that is the second question. A drug has 40% absorption and hepatic excretion ratio of 0.6. What is the bioavailability of the drug? Option A 16, option B 24, option C 20, and option D is 28. So here if we administer 100 molecules of the drug, amount absorbed will be 40 molecules because the absorption is 40%, and amount removed by the liver will be 40 into 0.6. 0.6 is the hepatic extraction ratio, so it will be 24 molecules. Hence, the drug available to produce the action will be 40 minus 24 equals to 16 molecules. So, bioavailability will be 16%. So, the option A is correct here. Now coming to the third question. A drug X was administered by continuous IV infusion at the rate of 1.6 mg per minute. Clearance of the drug X is 640 ml per minute. If the half-life of the drug is 1.8 hours, what would be the concentration of the drug after achieving steady state? Option A 0.0025 mg per ml, option B 0.004 mg per ml, option C 3.25 mg per ml, and option D is 1.22 mg per ml. So well, let's solve this question. We know that maintenance dose rate is equal to clearance into target steady state plasma concentration. So we can say here that 1.6 mg per minute is equal to 640 ml per minute into steady state plasma concentration according to the question. So here we can say that steady state plasma concentration is equal to 1.6 upon 640 is equal to 0.0025 mg per ml. So the option A is correct here. Now here comes the question number 4. A drug following first order kinetics is being administered by constant IV infusion at a rate of 10 mg per minute. Its steady state plasma concentration is 2 mg per minute. If the dose rate is increased to 20 mg per dl, what will be the new steady state plasma concentration? Here we know that the dose rate is equal to clearance into steady state plasma concentration. And in the first order kinetics, clearance remains constant. So we can say that steady state concentration is directly proportional to the dose rate. So if the dose rate is increased to 20 from 10 mg per dl, then this doubling of the dose rate will also double the steady state concentration. That is, if previously the steady state plasma concentration was 2 mg per dl, then the new steady state concentration will be 4 mg per dl. So we can say the new steady state concentration will be 4 mg per dl. Now coming to the fifth question, a patient in the IPD is suffering from respiratory infection for which antibiotic tobramycin is ordered. The clearance and volume of distribution of tobramycin in him are 150 ml per minute and 40 liters respectively. If you wish to give him an intravenous loading dose to achieve the therapeutic plasma concentration of 4 mg per liter rapidly, how much should be given? Here we know that loading dose is equal to volume of distribution, that is Vd, into target plasma concentration. So according to the values told in the question, so if we put these values in this formula, so we can say that 40 liters into 4 mg per liter equals to 160 mg. So 160 mg of this drug, of this antibiotic tobramycin should be given. And yes, also know that clearance plays no role in the determination of loading dose. So in this question, the clearance has been given just to confuse you. So well, okay, now, so let us look at the sixth question. A young patient suffering from severe asthma is brought to the hospital and IV theophylline is started at a rate of 0.48 mg per minute. Theophylline has a volume of distribution of 35 liters and clearance of 48 liters per minute. Its half-life is 8 hours. How long will it take for the plasma concentration to reach 93.75% of the final steady state? So here, and yes, about the plateau principle and the attainment of the steady state plasma concentration, these things have been already discussed in the previous video. You can watch that previous video also, and the link to that video has been given in the description box. And well, so far as this question is concerned, according to plateau principle, we have already discussed that after one half-life, 50% of the steady state concentration remains. And according to this principle, to reach 93.75% of the steady state, 4 half-lives will be required. As the half-life of theophylline, according to the question, is 8 hours, so it will take 8 into 4, that is 32 hours. So 32 hours will be taken. Thus we can see that in this question all data was given to you just to confuse you. The actual question lies only in the last line, that is how many half-lives are needed to reach the 93.75% of the final steady state concentration. Only this was the question. And now just look at the seventh question, which is the last question of this video. Drug X is normally administered to the patients at a rate of 50 mg per hour, and the elimination of the drug X from the body takes place as hepatic metabolism 10%, biliary secretion 10%, and by renal excretion 80%. This drug has to be administered to a 65-year-old patient with a GFR of 60 ml per minute, assuming normal GFR to be 120 ml per minute. In this question, liver and biliary functions are normal in this patient. What should be the dose of the drug X in this patient? Here we can see that GFR has declined to 60 ml per minute instead of 120 ml per minute. So we can say that renal function has reduced to 50% of the normal. So if 80% of the drug was undergoing renal excretion, but now in this case, now 40% of the drug will be excreted by renal route. So we can say that the percentage of the drug eliminated in this case will be 10% by hepatic route plus 10% by biliary route and plus 40% by renal route equals to 60% of the drug. So 60% of the drug is being excreted now. So now the dose rate should be 60% of the original. There is 60% of the 50 mg per hour. There is 30 mg per hour will be the new dose rate. So these were some important numerical questions from the general pharmacology covered in 2 videos. Soon I will be back with the next video which will have some other interesting questions from general pharmacology. In this way, chapter by chapter, we will keep on proceeding. And if you have any queries, you can write it down in the comment section, or for this purpose, I have also provided my email ID in the description box. So stay connected and thanks.